8:42 on your Tuesday morning. Next month is Men's Health Awareness Month, where some organizations are raising awareness to the challenges facing men and their health. Today, a new report is out looking at the statistics behind men's health. So joining us now is Brian Heilman, the senior researcher at the Movember Research Institute. Thanks so much for joining us this morning.
It's my pleasure. Thanks for the opportunity.
Yeah, so the new report calls men's health a family and community issue, not just a men's issue. Why is it so important to make that specific distinction?
Right, Alexis, well, think about your loved ones in your life, okay? Like if your father, your grandfather, your brother is really thriving, I'm sure you feel happy for them and it resonates and has a ripple effect on you. And likewise, if they're struggling, or God forbid, if we lose these men in our lives too early, it really affects all of us. So that's why we like to talk about health as a social issue that's shared among all of us, regardless of our gender.
Yeah, you just mentioned men in the U.S. dying younger than men in other wealthy countries. What do you think is driving that gap, or at least what does the research show?
Honestly, the statistics on this have been really tough to sit with as we worked on this report. We found that the majority of men in the United States die prematurely. What that means is 53% of men in the United States died under the age of 75, which is an international standard for premature mortality. And it is kind of a US phenomenon when you compare the average life expectancy among men in the US to the higher income countries around the world where men are living the longest. Men are dying about 6 years younger here than in the countries where men are living the longest. So that shows it's not just a men-women thing, like men themselves are dying younger here than in other countries. And I wish there were a simple solution to that. It's obviously complex as social and public health issues are in a country as diverse and huge as the United States, but it's certainly eye-opening and urgent.
Yeah, urgent and alarming for sure, but important to know. Another question I have for you. So mental health and loneliness, huge topics in this new report. Why are men struggling more than ever, and what do you think can be done?
I mean, loneliness and social isolation, you've probably heard, and your viewers have probably heard more and more about that lately as we move a lot of our lives online and still have the lingering impact of COVID and lockdown and the way that that isolated all of us. And truly, men as well as women are experiencing high rates of loneliness in our country. What we see though for men is that they just don't have the same amount of people they can turn to, or the same likelihood to actually reach out to someone for support if they're feeling lonely or feeling disconnected. And that's where we kind of bring that lens specifically to men. There was a survey in 1990 that asked men about their friendships, and back at that point, only 3% of men said that they had no close friends whatsoever. Today, that number is 15%. So it's almost 1 in 8 men who say they don't have any close friends in their life. And that's what we're paying attention to in this report.
So going off this report and all this information, Movember, that is about action for viewers watching today. What's one simple thing they can do right now to support men's health? Maybe reaching out, it seems, would be useful here.
Absolutely. I mean, Movember exists to prompt conversations about these important issues. Growing the mustache for the month of November is just an easy way to get people talking and make that conversation a little bit easier. So head over to Movember.com, learn more about what that looks like, and access the report.
All right, Brian, thank you so much for this information this morning.
Thanks.